anything that we have with regards to any health condition. So being in the healthy age weight group is important for not only pregnancy, but even any surgery or medical condition. If we're undergoing any operations, someone who's got excess body fat, excess weight, have significantly higher risks and complications. Even with medical conditions, in say, for example, at the moment with the COVID pandemic, people having excess body weight and struggling with obesity have worse outcomes if they had to be admitted in hospital or go to ICU and things like that. In a similar way, with regards to conception and pregnancy, there's always a slightly higher risk with regards to going through the pregnancy when you're getting excess body fat. So how does this affect you? So when you look at fertility, when we have excess body fat, then the patient or the individual has a significantly higher risks of infertility, miscarriages, weight, obesity, pregnancy-related problems such as high blood pressure, a condition called preeclampsia, gestational diabetes, higher risks or incidences of cesarean section and stillbirth. So the people who there have been studies where patients who've had bariatric surgery had children before bariatric surgery and after bariatric surgery, and they followed up the children, the babies born before when the mother was obese, have significantly increased issues with weight compared to the same sibling who was born after the weight loss operation. So it does affect even the children. When it comes to assisted reproduction, such as someone who's struggling with infertility, then actually another doctor who's an infertility specialist, Dr. Deval, is going to be joining us. He'll give you a bit of an idea on how someone's weight affects treatment for infertility and what actually goes on. So that it also impacts things. And like in Western Australia, if someone's got a BMI of more than 35, then they generally don't get selected or involved in infertility treatment because they want patients to be below a BMI 35. So this is a key consideration before they even go on to do that. Even with adoption and things like that, they've got weight of individuals as a criteria for being able to adopt a child. So these are the real problems that some of the patients face, and that's been brought to our notice as well. So if you go on to the other question is, right, I've got weight issues, I'm struggling with obesity, should I lose weight before getting pregnant? Based on what we've seen on the last question, we talked to with increased risks of complications in both during the pregnancy and after pregnancy and during delivery, it's very important to try and get control of the weight before we go ahead and have pregnancy, because that makes us healthier. It makes the patient have less risks related to pregnancy when your body weight is in a healthier weight group. Okay, and the other important thing is, if we go on to the next question, is very common questions is, how long should I wait after weight loss surgery or bariatric surgery to get pregnant? So there's enough evidence and a lot of experience and studies that show people who need to wait at least 12 to 16 months, 18 months before embarking on getting pregnant. Anyone who has children or get pregnant before that time will struggle due to many reasons. Mainly, if you're looking at the first 9 to 12 months is when people are actually losing a lot of weight with weight loss surgery. You're learning to get used to the amount of food that you can eat. Your nutritional imbalances will be there, so you might have iron deficiencies and vitamin deficiencies, which we are trying to manage during that time period when your body's adapting to that rapid weight loss. So getting pregnant around that early post-operative period within the year leads to a lot of problems. So we can't really ensure easily that your nutrition is going to be enough for yourself and to feed pregnancy. So it's very important to try not to get pregnant in the first year, and you have to look at certainly some forms of contraception. The main thing is sometimes even the oral, depends on type of weight loss surgery you've done. Certain oral contraceptives may not be as effective than type of like depot type of injections, and other forms of contraception may be necessary than just the pill. And also there's some new studies which show that if someone gets pregnant within less than say 6 months or to a year after the operation, then in the long term their weight loss is not as equivalent to someone who's actually had the pregnancy after 1 to 2 years. So it affects your actual weight loss journey as well, not just the potential risks to the child in your pregnancy. So it's quite important to try and not get pregnant in the first year and a half. So we've had a few patients having early pregnancies. They've got through them okay, but it is a bit of a higher risk. Okay. So what can we expect with pregnancy? Say you had surgery and then you want to go on, it's about a year and a half now, you're planning a family and you're pregnant. What can you expect? So this is something that is going to be beneficial for you in many ways. When you've lost all that excess weight, so certainly all those weight-related complications of pregnancy like gestational diabetes, high preeclampsia, risk of increased incidences of cesarean section, all that starts to decrease significantly. And the baby will also tend to be not having that what we call a first generation DNA change, which can cause increased obesity. So you're going to have some improvement in that way as well. And if you look at the pregnancy with after weight loss surgery, then you have to take a few things into consideration. So it's not just the same as having pregnancy when you've not had weight loss surgery. So there's a few things that we got to emphasize on. So mainly nutrition. So a key part of this whole thing is engaging a dietitian. In our practice, we've got a few dietitians, and we ensure that patients come back and be really engaged with them, being more closely monitored with your obstetrician and GP to make sure that you don't develop any nutritional deficiency. So some operations will cause certain different types of issues with nutrition. So generally, say for example, a gastric sleeve operation where we've reduced the size of your stomach, it can affect iron absorption as well as things like B12 absorption. A gastric bypass type operation can affect calcium, vitamin D, and folic acid absorption. So it's important to have regular blood tests and ensure that these important nutrients and vitamins are in the normal range to make sure that the babies do not develop any complications related to nutritional deficiency. So there can be issues like neural tube defect and spina bifida, those sort of things, if your folic acid is low, for example. And in pregnancy, people generally more prone to anemia. So, and after weight loss surgery, if you've not been monitored properly, then your iron levels can drop and increase the risk of having pregnancy-related anemia. So it's very important to be proactive and engage the relevant health professionals who are there to support you through the pregnancy. And then it's not a problem. So that's the main thing. So the other thing about pregnancy is there's no significant negative effects for the baby. Okay, generally we find that they may be small for gestational age, so the birth weight might be slightly lower compared to having had a sibling who was born to the same mother before weight loss surgery. However, that does not impact what the actual outcome is for in the long term. So it's important to remember those things and be involved with the care with all the specialists. Okay, and then the other question is, how will the pregnancy impact my weight? So that's a very common question. So generally, if we've gone through a pregnancy, you are going to put on some weight during your pregnancy, which is normal. So that's nothing, it's not unhealthy. It's not a bad thing to put on weight. So the important aspect of all of this is to ensure that we continue to make those healthy food choices. So not to let loose and give in because we're pregnant and start eating all the wrong food and then put on excessive amounts of weight. Then after delivery, it's going to be hard to shed that weight. So it's important to stick to those dietary advice from the dietitians, ensure that we take the right amount of nutrients and do regular exercise, which is encouraged throughout the pregnancy in order to facilitate regaining your pre-pregnancy weight or even better. So it's important that work with us, work with the dietitians, work with our exercise physio, gynecologist after the pregnancy, even to keep that weight off in the long term. Okay, so that's another key component of after pregnancy. Okay, so that's a bit of a short presentation on how a pregnancy affects and with bariatric surgery. So if anyone's got any questions, please feel free to use the chat feature to type in any questions, and I'm happy to answer what I know. So one of the question is, how do we know how much vitamins do we need to take when we pregnant? So this is quite different for different people, depending on type of surgery that you've had. So there are some operations which can be quite malabsorptive. So there are different types of weight loss operations. So the more the operation causes weight loss, something like a duodenal switch or SADI and SIPS type procedure, then you need more vitamin intake. So you need to, because your absorption is much reduced. So you got to take much higher doses of all the different vitamins, especially what we call the fat soluble type vitamins. So that affects the type of vitamin, how much you need to take. In the same way, if you've had a sleeve, which is pretty straightforward, then the requirements will be different. Someone who's had a gastric band, even though we rarely do them nowadays, then the nutritional requirements will be a little different. So it's tailored to each individual person, and that's how we sort of determine what's the best way to do that. All right, any other questions? All right, okay, I think that's the end of the questions. So thank you everyone for, okay, someone said something. So one of the questions is, do you have another sleeve surgery after giving birth? No, you definitely don't undergo another sleeve surgery after giving birth, because your weight loss surgery has been done, and it's not like your stomach's gonna stretch back to its normal size or anything like that. It's so you don't need another operation to fix that if you've had a pregnancy. So it's not really, we wouldn't do another sleeve if someone's had something like that. Okay, everyone, thank you so much for your time. Thanks for listening in. If you've got any other questions, and if you'd like to have a further chat, yeah, just feel free to call us and book in to have a chat with me and our dietitians, and we're more than happy to help you. Thank you. Have a good evening.